The majority of the population is women. 60% of the household healthcare choices are made by women. So they are decision makers. It doesn't make sense to have a great technology that aims to improve access that relies on the internet if you're going to an area where there's no internet.
Marloes, women's health in Africa is often framed as a development challenge rather than a market opportunity. What does this narrative get wrong, and where do you see the real opportunity?
I think what this narrative doesn't realize is actually that Africa is a continent of the current and future. If you look at the population, it has a very young average or median age of 19. The majority of the population is women. 60% of the household healthcare choices are made by women. So they are decision makers. The African population is also increasingly growing in terms of income. So there's a higher middle class that has an ability to make decisions and on spending also on healthcare and being able to pay for quality healthcare. But going back to the fact that 60% of those decisions are being made by women, makes you realize actually there's an economic opportunity here, because those women make choices and have an ability to pay for quality healthcare services. So I think that is the narrative that should be kept in mind when talking about women's health.
And when it comes to technology, where do you think that the technology can make a real difference in closing the gaps in women's health?
Because of digital solutions, healthcare can now be accessible to women on their phone, for example, or at the dispensary through a tablet or whatever, where first they had to travel to the city to get access to a specialist. But now it can be on a mobile phone or through a tablet, thereby, closing that gap in terms of transport, in terms of fees that transport costs, in terms of accessibility of the specialist might not always be available, and digital solutions bridge that gap.
But do you believe that the technology is the answer to all of those challenges in women's health? Is technology enough, or when we think about the system, is there something else we should?
So technologies are not the solution on its own. So technologies need to fit within the existing infrastructure and systems that are there. It doesn't make sense to have a great technology that aims to improve access that relies on the internet if you're going to an area where there's no internet. So you need to make fit for purpose solutions that match within the system, but also within the cultural beliefs, within the practices in the healthcare system that are there. So you really need to know the local context, the local beliefs or health-seeking behavior patterns, and apply your technology or adjust your technology in that way. And that is different for different countries in Africa. Burkina Faso doesn't have the same health-seeking behavior necessarily than in Kenya. In Egypt, it might be different than in South Africa. So you really need to know your local context and health-seeking behavior also in terms of decision-making for women, and align your solution to that.
Yes. And of course, Africa is not a country, right?
Yes.
Africa is a very big continent. And for context, can you tell us how many countries? More than 50 countries? And
55 or 54, depends how you count it.
And more than 1 billion people in Africa.
Definitely.
So, so big diversity and understanding of this market, and all this diversity is very
only
very
growing. In some years to come, 2050, most likely Africa will be the highest populated continent in the world, and more than half of those are women. So you can see how big the opportunity there is to really support women get better access to care.
And if you were advising a technology company right now, what would be your recommendation for them when it comes to?
In terms of women's health?
Technology, women's health.
Understand the women that you're making your solutions for. Understand that a woman in Kenya is different than a woman in Ghana. But also in Kenya, you have different cultural tribes, religions. So a woman in Kenya is also not a unilateral woman. You have a woman in Marsabit that might be different than a woman based in Nairobi. A woman in Kisumu might be different than a woman based in Kilifi due to religion, ethnicity, economic status, rural-urban status. So you need to understand this. Doesn't mean that you need to create a technology that is super localized, but you need to understand that. You need to know, you need to work with local languages, local beliefs, also realizing that not everybody is literate. So you cannot make very difficult text, but create visuals. So make it low-key and acceptable for women to use. Yeah.
Perfect. Thank you very much, Marloes.